Have you heard of the lip flip? Well, the lip flip is gaining popularity as a quick and simple way to enhance your lips without actually adding volume. But what is it, and is it the right choice for you? Hi everyone, I'm Dr. Weinstein. I'm a board-certified dermatologist. And today I'm going to explain everything you need to know about the lip flip. So what is the lip flip? The lip flip is a quick and simple procedure that board-certified dermatologists use to inject a neuromodulator, so something like Botox, Xeomin, Dysport, and we inject it right around the lip into the muscle called the orbicularis. These tiny little injections, so we're talking like 1 or 2 units, help to relax the muscle that causes our lips to be tense. So if you make like a pursing expression, for example, like this, or a pucker expression, it's going to relax that muscle so that you're not able to do that as forcefully. In addition to relaxing the muscles around the mouth, it also helps to gently lift that top lip, that cupid's bow area of the lip, up so that the lip is more everted, or you get a little bit more lip show. So you can imagine that this creates the appearance of a fuller lip without actually adding lip filler. Now, injections in a similar area, so right at the side of the nose or the nasal ala, can also help improve the appearance of a gummy smile. So if you're somebody who, when you smile, you realize that your lip disappears and also you have a lot of gum show, this simple tweak, maybe 3-4 injection points, is a really easy fix. Another benefit of the lip flip is that it can help reduce the creation of those vertical lines above the lip. Now, often these are called smoker's lines, and we see them all the time in middle-aged patients or even younger who've never smoked a day in their life, but they're really formed from that constant movement and actually just the way we speak and express. And so obviously you shouldn't change the way you speak or the way you express, but softening that movement around the lip can definitely help prevent the formation of those vertical lines. And let me tell you, I hear all the time in the office that patients come in maybe in their 50s, 60s, and they are so bothered by vertical lines around the mouth. So a simple treatment like a lip flip can help prevent the development of those over time. Because once those lines become etched, it's going to take time, money, and maintenance to help to smooth them out again and get them to a place where you feel like they're not so visible. And if you want more information on that or treating perioral lines, we can dedicate a whole nother video to that. But for now, for the lip flip, just a few small injections above the upper lip. We're talking about 1 to 1.5 units to help give the lip a more everted look and to give you more lip show, and especially helpful when you smile so you don't lose that show of your upper lip. Now, if you've made it this far, thank you so much for supporting this channel. Please hit subscribe so you can stay up to date with my new content every week. Now let's get back to the video. Okay, so we talked all about lip flip and the benefits of it and how simple it is, really. Now let's talk about how long the lip flip will last. Now, the mouth is a very mobile area, and you can see your orbicularis, that muscle that is very superficial, is working hard all day because we're talking, we're eating, we're smiling, we're engaging and interacting with our colleagues and our friends. And so the effect of the lip flip tends to last about 6 to 12 weeks. Now, that's a broad range, and it varies per individual and obviously how much you're using your lip. Often the more you use the area, the quicker the neuromodulator effect will wear off. And so if you're one of those 6-weekers, and it's definitely something that you need to keep up with if you enjoy the benefit of having a fuller looking lip. So let's talk about people who should avoid getting a lip flip. There is definitely a niche group of people who would be very bothered by the effect of a lip flip. And those are people who rely on those fine motor movements around the mouth. So for example, if you are a musician and you play an instrument like the clarinet and you really rely on those fine motor movements while you're playing your instrument, lip flip is probably not the right treatment for you because you will feel a difference and it might affect your ability to play as well as you did prior. The other case we see with patients who are frustrated by getting injections. So if you're the singer of your band, it's probably not a great idea for you to be getting injections around your mouth like a lip flip, because we're weakening that muscle and you might not be able to, again, make those movements that you need to fully enunciate your words while you sing. If you want a lot of volume in your upper and lower lip, or you want to change the shape of your lip, the lip flip is not for you. You'll definitely may be disappointed by the results. The good and bad thing about the lip flip is that it works nicely, it's subtle, it's really not enhancing the volume. We're not aiming for duck lips here, but it makes a subtle improvement to the volume of your lips. I said the good and bad thing. So the good thing is that there's subtle improvement. The bad thing is that it wears off. So if you absolutely love it, it's something that you probably will maintain over time. But if you hate it, it'll wear off and you'll never have to do it again. What should you expect after the injections? After the injections, there might be a little bleb or bump in each of those 4 areas that were injected, and that'll die down within 10 minutes or so. The other thing you can expect is really nothing for about 2 weeks. The full effect of any neuromodulator takes about 2 weeks to kick in. So if you have an important event coming up the next week, or even that evening, there's really not going to be any evidence that you did anything in the office that day. You need to wait the full 2 weeks, and then typically we have you come back to the office to check and make sure the results are what you were hoping for. All in all, the lip flip is a simple and effective, minimally invasive way to enhance your lips. And really, there's minimal commitment. Like I said, it wears off, but if you love it, you can maintain it. Or you can plan accordingly and just have the injections prior to an event, or family photos, or wedding, or something where you just want a little tweak. If you're curious and you have more questions about procedures like a lip flip, make sure you talk to your board-certified dermatologist to see if something like this is appropriate for you. Don't forget to like, comment, and subscribe for more aesthetic insights, and I'll see you in the next video.